Chapter 10: Diseases affecting the temporomandibular joint. Vocabulary: arthrocentitis, surgical puncture of a joint followed by a lavage of the joint space. Arthrography, radiography of the joint after injection of opaque contrast material. Arthroscopy, method for evaluating and manipulating a joint via the insertion of a camera and instruments. Articulation, another word for joint. Auscultation, listening to sounds within the body using a stethoscope. Crepitus, a dry, crackling sound. Laterogenic, inducing inevitably by a medical or dental care provider or by medical treatment or a diagnostic procedure. Magnetic resonance imaging, MRI, non-invasive diagnostic technique that uses radio waves to produce computerized images of the internal body tissue. Palpation, physical examination using pressure of the hands or the fingers. Sign, objective evidence of disease that can be observed by a healthcare provider rather than by the patient. Symptom, subjective evidence of a disease or a physical disorder that is observed by the patient. Trismus, inability to fully open the mouth. Myofascial pain and dysfunction. MPD comprises at least 50% of all TMDs and is the most commonly involved of the masseter muscle. Pain is frequently worse in the morning, in particular in patients who clench or grind their teeth during sleep. It is characterized by dysfunctional muscular hyperactivity with regional pain and tenderness of the affected muscle and variable amounts of reduced opening and complaints of malocclusion. The direction of deflection depends on the location of the involved muscle. Internal derangement or disc derangement is defined as an abnormal positioned relationship of the disc relative to the mandibular condyle and the articular eminence. Patients often present with continuous pain localized to the TMJ that is exacerbated by jaw movement. In some cases, the disc is displaced anteriorly and returns to its normal position on opening of the mouth or movement away from the associated side with reduction. Arthritis is defined as inflammation of a joint or classified as either osteoarthritis or rheumatoid arthritis. Osteoarthritis, also referred to as degenerative joint disease, is most common disease affecting the TMJ. Dysfunctional articular remodeling due to either decreased adaptivity capacity of the articulating structure or excessive or sustained physical stress that exceeds the normal adaptive capacity leads to degenerative changes. Hypermobility disorder, including dislocation and subluxation. Dislocation occurs when one or both of the condyles translate anterior to the articular eminence, resulting in an open lock that the patient cannot reduce. It may occur spontaneously or after opening the mouth widely, such as when yawning, eating, or during a dental procedure. Dislocation should be reduced immediately by applying downward posterior pressure to the mandible to relocate the condyle within the glenoid fossa. Prolonged or chronic dislocation may require muscle relaxants or general anesthesia. Subluxation refers to hypermobility to which the patient is able to relocate the mandible back to the glenoid fossa. Ankylosis of the TMJ is defined as immobility of the condyle because of fibrosis or bony union between the articulating structures of the joint. Ankylosis can be classified by tissue type, location, and extent of fusion. Joint infection, usually after trauma, accounts for 50% of TMJ ankylosis, but 30% results from trauma without infection.